Does the president know there is a historic measles surge occurring nationwide?
I'm sure he does.
You're sure he does? He talks publicly about the ballroom 1 out of every 3 days. I have a question. Do you know how many times the president has spoken about the measles epidemic?
I don't count that.
You've talked a lot about trust. The people don't trust you.
Tensions in the Senate have reached a fever pitch. Senator Blunt Rochester isn't just questioning health policy. She's also attacking the secretary's credibility. She's comparing the president's golden ballroom obsession to a record-breaking measles outbreak in 25 years, labeling the administration reckless. But it's not just politics. Senator Murkowski is revealing the harsh reality of rural America, exposing shocking 87% cuts to basic hygiene services. RFK Jr. is in serious trouble this time. Let's watch.
Senator Blunt Rochester.
Thank you, Mr. Chairman. The United States first became measles-free over 25 years ago, a quarter of a century. We have maintained that status in every year since, until you became secretary. A simple yes or no. Does the president know there is a historic measles surge occurring nationwide?
You want me to answer
the question? It's just a very simple question.
You just want a grandstand.
You're going to get your opportunity.
You want a grandstand.
Can you answer?
I can answer that question.
Yes
I didn't cause the measles epidemic. It started before I came in.
Sir, I'm giving you the opportunity to answer the question. Mr. Chairman, can I get my time back from this rudeness? Mr. Chairman?
I'm sorry.
I was asking, can I get my time back
Yes, you can.
from him interrupting
Yes.
a simple yes or no question? Does the president know there is a historic measles surge occurring nationwide?
I'm sure he does.
You're sure he does. Remarkably, Ralph Abraham, your former CDC principal deputy director, said that losing our measles-free status is not really significant and just the cost of doing business with our borders. Another simple yes or no. Does the president think this is not a significant issue?
Losing our measles elimination status?
Yes.
Well, most of the countries are losing that.
Does he think it's a significant
sure he doesn't
problem?
think it's a good development that's happening all over the world.
Have you talked to him about it?
About measles?
About the outbreaks? About the crisis in this country?
I have.
Okay, so yes or no, he does know it's a problem.
Yes.
According to the Washington Post, the president makes public statements about his plans for the new Golden Ballroom at a pace that rivals and even exceeds the mentions of some major policy priorities. He talks publicly about the ballroom 1 out of every 3 days. And so I have a question. Do you know how many times the president has spoken about the measles epidemic?
I don't count that. We don't keep track of that data at the CDC yet.
So as head of our nation's head health agency, have you advised the president to sound the alarm and encourage Americans to obtain the measles vaccine?
Am I going to get a chance to answer this, or you're just going to talk?
That was a question for you.
Excuse me?
The question was, have you alerted the president to sound the alarm? You're the head of HHS, the leading health agency in our country.
That's my job, and we do it.
So yes or no?
It's my job, not the president's job, and I do my job.
I'm concerned about it. I've watched a lot of these hearings. You blame the Mennonites, you blame immigrants, you blame the globe. We've been part of the globe, and still we are in this situation. Do you take any responsibility in your role for the situation that we are in with this measles epidemic?
As I said, the measles epidemic began before I came into office.
I'm going to take that as a no. The Pan American Health Organization was scheduled to review our measles-free status on April 13th. Did your department request to delay this independent international review of our measles elimination status to November after the election?
No.
So you did not request it. You had no knowledge of the request. You had no communication with the White House. Thank you. It's awfully convenient that we're postponing it until after November when people won't have the opportunity to know our measles status. I would just say this, there has been a lot in terms of polling on trust. You've talked a lot about trust. The people don't trust you, and I would ask, what is different from all these other years? You are. If the American people don't trust you, which most of the polls show, I don't know why the president should trust you either. I yield back.
Senator Murkowski.
Mr. Chairman, thank you. Secretary, welcome back to the committee. You and I have had many opportunities to talk about IHS funding, and I appreciate your trip to Alaska last year, very targeted on what we are doing with regards to health care for Alaska Natives, as well as American Indians, Native Hawaiians. So I appreciate what we're seeing with the advanced appropriations for IHS in the budget. This really helps with providing certainty to our tribal health systems. So that's a good. Another good is the $1 billion increase, including critical investments in IHS, health, IT, and the hospital oversight. So good there. Where I do have concerns is the reduction that we're seeing in the sanitation facilities construction account. This is an 87% cut. And you have had an opportunity on your visits to Alaska to see what it means when you have communities that don't have running water, that don't have clean drinking water, that don't have sanitation facilities and are using honey buckets. So we've made some good headway under the infrastructure law, but that was intended to supplement, not supplant, our annual appropriations. So I just want to make sure that you are committing on behalf of your folks within IHS to maintain a key eye on funding for tribal sanitation facilities construction. We're going to work, I'm certainly going to work on my side on the Appropriations Committee, but also as chairman of the Indian Affairs to make sure that we don't go backwards on these important investments in basic sanitation for people in remote areas.
Absolutely. If that, we had to get cuts across the department. IHS was protected from those cuts. Yeah. They received $1 billion for infrastructure. Nobody else, I don't know, across the government has received that except maybe the Defense Department. I've made more visits to Indian country than any HHS secretary in history. And if, we don't like to make any of these cuts, it's up to Congress ultimately. If you appropriate the money, I, of course, will spend it.
Well, and know that we want to work with you to make wise investments. But again, when we think about those areas where we see just really dispiriting health outcomes in rural areas, so much of it can be traced back to they don't have access to basic clean water and sanitation. So we want to work with you on that. Last year, I had a chance to raise with you the LIHEAP program, the Low Income Home Energy Assistance Program. We have had a pretty tough winter. I was in Fairbanks over the weekend, and I was reminded that they had 152 consecutive days of temperatures below zero. 152 is a long time to be cold. And so this is where I look at LIHEAP, and it's not just kind of a nice to have, but for so many, it was very imperative. So I'm worried again that that LIHEAP funding is not made a priority. Last April, you eliminated all staff assigned to administer LIHEAP. It's my understanding now that responsibility for administering the entire program rests with a single staff member. I really hope that that is not accurate, but we need to know that not only these levels of important support are going to continue, but that there is adequate staffing to help address this. And I think particularly, it's not just cold winters that we faced, but now all of our families are seeing increased prices when it comes to to home heating fuel. So many of our communities are diesel-powered communities, and the price of diesel is going to be shockingly high when that first spring barge comes in June. So I'm just asking for your help once again. I know you understand the priority of LIHEAP, but I'm putting it back on your radar.
And I spent all 90% of the money that I could spend. We've now gotten the last 10% released, and we will spend that. So we have adequate staffing to do that, and you know how I feel about that program.
Well, again, I'm just putting it back on your radar. I've got 20 seconds to just raise my concerns about the programs focused on domestic violence and sexual assault program. You have combined into a single program under the Administration for Healthy America. This is the Delta program and the RPE, the Rape Prevention and Education. I'm concerned that the programs aren't interchangeable. They serve distinct populations, different models, administered through fundamentally different structures. But I'm concerned that we're looking at nearly half the funding for programs that have a really proven record of improving public safety, reducing crime, and protecting victims of domestic violence and sexual assault. So again, I know it's a priority of yours, certainly a priority of mine, that we have effective tools when we're talking about prevention of domestic and sexual violence.
Thank you, Senator.
Thank you. Thank you, Mr. Chairman.